The hips popping up is a result of loss of ability to maintain the hip and the back angle off the floor of the deadlift. The hamstrings and erectors anchor the hip into position. And this is a motor pattern problem. We're trying to teach the bones to move correctly in the right order at the right time. In this case, we'll need to take some weight off the bar and teach the deadlift with proper form. So tighten up your hamstrings and glutes before you start the pull. These muscles are responsible for holding the ass down, and if this doesn't work, think about moving the chest first off the ground. When the pull is done correctly, it feels like a shorter range of motion. And this is largely due by the perception of the lifter and the actual time it takes to complete the lift. And this is because when it's done correctly, there's no extra moment from the hip. The knees and the hips work together to make the lift as efficient as possible. A correct deadlift results from a correct starting position, which will leave a more vertical back angle as the pull starts. In the clean or the snatch, the start position, your back angle will be pretty vertical, and that back angle will be preserved through a longer range of motion. And this is because you need the long moment for rapid acceleration to move the bar through space. Most common problem in the deadlift is the deadlift back angle is too vertical. Many mainstream fitness wellness agencies advocate a vertical back angle to reduce shear force on the spine, so it becomes more of a compressive force. But shear doesn't happen in the vertebral segments, and this is because the vertebral segments overlap at the facet joints, and sliding of these segments is not possible. The role of the erectors and the abs is to keep the spine rigid. Because no movement takes place in the spine, no shear force exists. But sometimes it's hard to keep the back in extension, and this is why a deadlift is a good back exercise.